Okay, so we are going to discuss the head injury extradural hematoma station. A 25-year-old motorcyclist got an RTA and came to accident and emergency department. On admission, his GCS was 15 and he had 2 episodes of vomiting, and then he had amnesic events. Examination: BP 115/90, pulse is 64, respiratory is 10. After 30 minutes, his GCS fell to 8/15 and cardiovascular parameters started to deteriorate. You will be shown a CT scan in this knowledge station, and which is like this. So this is a lens and a lenticular shape extradural hematoma, EDH. What do you see in this CT? So biconvex shape, hyperdense lesion, midline shift, yes, and compression on the ventricles. There is compressed ventricles as well. So you will say that this is a CT brain plane, and showing a biconvex shape hyperdense lesion. Most probably it's giving the history of trauma. Most probably this is extradural hematoma, and resulting in midline shift of brain and compression on the ventricles. What were the indications of doing CT scan in this patient mentioned, which are included in scenario? So National Institute of Health and Care Excellence guidelines for CT scan in head injury, or you will do CT imaging in head injury within 1 hour and within 8 hours. So anytime your GCS is less than 13, at any point GCS less than 15 at 2 hours. So at any point less than 13 and less than 15 at 2 hours, for example it's 14 but at 2 hours duration. Focal neurological deficit, suspected open depressed skull fracture, greater than 1 episode of vomiting, post-traumatic seizure. So you have to do CT scan within 1 hour. Okay, so if the age is greater than 65, or like extreme of ages, for example it's a child, or it's a old age like greater than 65, so you have to do CT within 8 hours, or he's on warfarin or aspirin or any coagulopathy, or using blood thinners. Dangerous mechanism of injury, for example fall from height greater than 5 feet or greater than 5 stairs, RTA, retrograde amnesia greater than 30 minutes. So in such cases you have to do the CT scan within 8 hours, and here immediately within 1 hour. What are the signs of basal skull fracture? So there can be hemotympanum, blood from the ear, raccoon eyes, battle sign, ecchymosis on the mastoid process, and CSF otorrhea rhinorrhea. Normal value of intracranial pressure is 7 to 15 mm of Hg supine, and when it's standing, so it can be 10 to 15 mm of Hg.